Hi, everyone. I welcome to this session. My name is Alejandra Marquez. I am so glad you are here and join us for tonight's session in our Type 1 diabetes screening series. Our topic for tonight is One Family's Journey, how we decided to use Teplizumab to delay Type 1 diabetes. Goes beyond science. It's about real emotions, real decision, and real families navigating uncertainty, hope, and courage together. At Diabetes Sister, our mission is to support and empower women living with all types of diabetes through education, peer connection, shared experience, and tonight, conversation is an opportunity to learn not only about groundbreaking treatment, but also about the human side of the decision-making progress. We are honored to be joined by two experts and two incredible women sharing their life experience. First, my amazing Dr. Victoria Bouhair, triple board certified endocrinology, lifestyle medicine, and obesity medicine, and founder and CEO of Perry Wellness and Diabetes Center here in Charlotte, North Carolina. She also serves on the Diabetes Sister Board of Directors and is a national leader in early detection and prevention. Jude Johnson is a licensed psychologist specialized in behavioral health, coping strategies, and chronic illness management. Johnson will share insight how fear, hope, uncertainty affect our decision and how family can stay emotionally grounded through it all. Chelsea Leggett, a family nurse practitioner and certified diabetes care and education specialist with over a decade of endocrinology experience. Chelsea lives with type 1 diabetes, as do two of her children, giving her a compassionate and practical perspective on early screening and treatment choices. And the last person is Sonia McNeil, a holistic wellness advocate who blends natural approaches with emerging health technologies. Sonia's curiosity, openness, and dedication to her family offer a unique lens on exploring new treatment like Teplizumab. We are so grateful of each of you for sharing your time, and story, and expertise tonight. Thank you, everybody who's coming tonight. I'm going to tell you housekeeping before we begin. Just a few quick notes. Use the Q&A in the menu box anytime if you want to make a question. Our speaker will address questions during the discussion. And after our main session, we will move to the breakout room for a small group conversation and Q&A. When the presentation ends, you will see pop up join your breakout room. Just click join and we're going to the Q&A session. Okay, let's go started. And I will please join me and welcome Dr. Victoria, who is going to open our discussion for tonight. And I hope you can learn something new about the screening type 1 diabetes. Thank you, Dr. Victoria.
Thank you.
Your screen.
Thank you. Thank you. Thank you again for that very, very warm welcome. Welcome everyone to today's webinar. So we're going to talk about screening for type 1 diabetes. And as Alejandro mentioned, the medication Teplizumab, which has recently been approved. So let's start with the basics. What is type 1 diabetes? This is considered an autoimmune condition. And what that means is that your body produces some proteins that essentially attacks itself. And the cells that it attacks are called the beta cells. The beta cells produces insulin. And without insulin, your body cannot regulate blood sugar levels. So you end up having a very high amount of blood sugar levels, which can lead to serious conditions such as diabetic ketoacidosis. We all know that living with type 1 diabetes has its own unique struggles. There's a need for constant monitoring. There's a need for establishing a healthcare team, one that you trust, one that's reliable, one that's covered through your insurance. How do you balance exercising? How do you balance food? How much insulin do you take? All these questions that have to be answered. Purchasing insulin and its expense, the type of insulin to use, as well as its emotional struggles. We know that within diabetes, there's depression. There's also higher risk of what we call diabetes distress. The risk of developing type 1 diabetes does increase if you have a family history of type 1. In fact, if there's a family history of any autoimmune condition, that can also increase your risk of type 1 diabetes. And this risk can be as high as 30% if you have both parents with type 1 diabetes, all the way down to 1 to 4% if you have a mother with type 1 diabetes. However, what we do know is that over 85% of people who develop type 1 actually do not have a family history of the disease. So that means that majority of people have the diagnosis of type 1 diabetes without any suggestion of it or family history. So really no warning sign. And unfortunately, about 40% of people who are diagnosed with type 1 are diagnosed with that life-threatening condition, which I mentioned earlier, diabetic ketoacidosis. Traditionally, type 1 diabetes has been diagnosed at that stage, what we call stage 3 type 1. And what happens at that stage is where you really see those clinical signs. You have the high blood sugar levels, you have the signs of type 1 or signs of diabetes, increased thirst, urine, etc. But what we know is that type 1 diabetes actually exists long before, months to even years before stage 3. Stage 1, 2, and 3 is present when you have at least 2 autoantibodies present in your blood. In stage 1 type 1 diabetes, those antibodies are present. However, your blood sugars are normal and you do not have any signs or symptoms of type 1 or any signs or symptoms of diabetes, period. And then stage 2, you have mildly elevated blood sugar levels, but no signs and symptoms of it. So again, instead of waiting till you get to stage 3, now we have the opportunity to really be able to establish the diagnosis of type 1 diabetes at stage 1 or stage 2. Why would you want to screen? Many reasons. One, we can really prevent hospitalizations. If you're screened and you are diagnosed in stage 1 or stage 2, we can monitor you. What we know is that those who are screened and monitored, the risk of diabetic ketoacidosis drops from 40% all the way down to less than 5%, which is very impactful. It also allows you to be prepared with knowledge. You can be prepared again, establishing that healthcare team. And also you can have the ability to do your research. If you want to enter a clinical trial, you can talk to different people and see what type of monitoring that they're using, be it continuous glucose monitor or finger sticks. You also have the ability for early treatment. Teplizumab is one that we will talk about later on in this presentation. The screening process involves autoantibody detection, and therefore they're currently recommended by the American Diabetes Association. As long as you have any four of these antibodies present in your blood, then, and of course confirmed, then you're diagnosed with type 1 diabetes. There are many ways in which you can screen. The first two examples, Ask and TrialNet, are research-based screening programs. You can also do it through your state. Cascade and Pledge are statewide screening programs. Finally, through your healthcare provider, you can get a kit at their office through Enabled Biosciences, or your primary care or healthcare team can actually write a prescription for these antibody tests, and that can go to LabCorp, Mayo, or Quest. Teplizumab is a new medication that was approved November of 2022. And it's really exciting because for the very first time, there's a medication that really treats the root cause of type 1 diabetes. This is an IV infusion that's given once a day for 14 days in a row. And currently is indicated for people who are age 8 or older who are diagnosed in that stage 2 type 1 diabetes. And this time, it doesn't really affect the blood sugars per se, but it helps your body immune system to prevent further destruction of those beta cells. The good news is that it has been shown to delay the onset of stage 3 type 1 diabetes by about 25 months after infusion. I'm going to hand it over to Jude to talk about the power of knowing and why we should get screened.
Okay, thank you so much, Dr. Bahari and Alejandra, for your warm introduction. It's a pleasure to be here with you all. And, it's natural to have some fear when we're thinking about the what ifs of type 1 diabetes, right? So if you're considering testing, I totally get how it could evoke fear about testing. Like, what if this test is positive? What is this going to mean for us? How is this going to change my day-to-day life that is already more full than I can even keep up with? I mean, how many people here feel like that you're on a treadmill and that you can't quite keep up with the speed that it's running at? I mean, I kind of feel that way sometimes. I think most people do. Life is full of lots of to-dos and things that we have to take care of. So the idea of testing and then having to deal with a medical condition that's going to require us to take some action likely is going to create some feelings of resistance, even if we know that might be the right thing to do. But screening, as Dr. Bahari said, could turn our uncertainty to really understanding this much better. Reducing the DKA diagnosis from 40% to 5% really is so powerful because it's putting knowledge in your hands so that you can take action and really avoid potential crisis, giving you more time to prepare, to do some research, to understand what kind of support that you're going to need along the way. So instead of asking that question, what if we test? Oh no, what will I have to do? We can ask, what if we don't test? And if we don't test and you fall in that category of being type 1 diabetic and not knowing, you could end up finding yourself in a crisis. And being in a crisis is so difficult, right? Ending up in the emergency room or ending up in a situation that is causing more stress for you and your family, screening can help prevent that intensity and that challenge and allow you to prepare for not only the medical journey, but also the emotional journey that you find yourself going through. So facing the uncertainty is hard. Uncertainty breeds fear when we don't know the outcome of what something is going to provide. We can feel fear. But knowing can give us more clarity and can give us confidence in our ability to choose what our response is going to be. So what can we do to help manage the feelings of fear or anxiety that might come up when we think about testing? And this first skill is called grounding. It's called the 5-4-3-2-1 method. And it's simply using your five senses as a way of inviting yourself to come into the present moment. So even right now, you might look around the space that you're in and just mentally note five things that you can see, like microphone, cup, computer, phone, bottle. You know, uh, naming things like this that you can see in your environment invite you into the here and now. And when we're feeling worried or we're thinking a lot about the future, what we're doing is we're inviting ourselves to be in the here and the now, and seeing is one of those sites. Four things that you can touch. So in the same environment, you could touch things and you could notice, how does that feel? Is it warm? Is it cool? Is it soft? Is it hard to the touch? Three things that you can hear, you know. Maybe it's the sound of my voice, or maybe it is some sound coming from inside the room that you're in or outside of the room, and just closely listening. Two things that you can smell. Maybe you have a piece of gum or a mint or perfume, something that you can really capture the scent of the moment, and that brings you into the here and now. And then lastly, one thing that you can taste. So maybe you have a mint or something, and another thing that you could also do as it relates to touch is that if it's really ramping up and you're having a hard time getting grounded, you could grab an ice cube. If you're cold adverse, you could go wash your hands in nice warm water, and that's going to be soothing and bring you into the here and now. The next skill here is stop. It's a mindfulness skill that you can practice multiple times a day, even for brief periods of time. And the first step is to stop, to pause. I mentioned being on that treadmill, right? It's sometimes very difficult for us to pause when our days are packed for, taking care of our own needs, the needs of others if you're a parent, or you're caring for the needs of others, maybe your own parents. So once we stop, once we pause, that interrupts the train of thoughts that's going on so that we can then take some deep conscious breaths. And so you're invited, even as I'm talking now, to take a nice deep breath and act like you're blowing through a straw. Nice, slow breath out. And just that one deep breath, slow breath out, sends a message to your brain and your body that even if you're under stress, even if you're having fear, that you're going to be okay. So you can take a few of those, which is actually preparing you for the next step, which is observing. What are you going to observe? Well, number one, you're going to observe your body. How does my body feel in this moment? Where is it connected to the chair, to the floor? Maybe I can just notice gravity act on my body. Maybe I'm having some emotions. Well, where do you feel emotions? In your body. It might be in your throat, in your heart, in your stomach, in your shoulders, in your neck. Wherever you notice it, just try to observe, not try to fix it or solve it, just to notice that it's here. To acknowledge it is really a big piece of the process here. So I might even say to myself, feelings of fear or pressure on my chest or my stomach feels like it has butterflies in it right now. I'm just labeling what's happening in this moment. Or I might even say, oh, thoughts about the future. That's putting a label on what you're experiencing in the moment. And it's engaging the frontal lobe of your brain, which helps you calm your nervous system because this part of the brain, the frontal lobe, uh, is often offline or disengaged to some extent when we're in a fight, flight, or freeze mode. So just labeling in that way can help. If you think about being in a classroom setting and having an a question, but you don't want to ask because you think it's a silly question. Nobody's asking that. Why am I even thinking this? And then someone else asked that same question. How do you feel? Relief. Whew, so glad somebody else asked that. We can acknowledge our experiences, which can help dissipate some of that stress and that challenge that we're feeling. And lastly, we can't sit there for too long, right? We're going to have to get up and get back to work or taking care of our own needs or the needs of others. And so when we do, the invitation is to be present in this moment. So really to notice what you're doing. So maybe you're going to send an email next, or maybe you're going to go do a chore. Whatever you're doing, see if you can do it with full attention to that task in the moment. That will reduce your stress because when we're trying to do two things at once, when we're thinking about one thing, trying to do another thing, it causes a lot of stress for us. So that attention really helps. And the more you practice that, the more you can really wire in a mindful approach to addressing things that are going on. And in fact, I would encourage you to practice this skill when you think you don't need to, when you're feeling okay and calm. Because the more you practice it, the more it will naturally become an instinct to practice when you really need it, when you are stressed. So, how can we reframe? How can we mindfully reframe this question of what if? What if I test positive? What if this terrible thing happens that I'm worried about? Instead, we can say, what can I do right now? What is in my control that I can make a step forward and take action on what's in front of me? And taking that action, no matter what, how small it may feel, towards what's going on can often help us feel better. Uh, and lastly, self-compassion. How can you talk to yourself in a way that you would talk to your very best friend? You know, if your best friend was having a difficult moment or they were feeling anxious or worried or unsure what to do, and they came to you and said, "Oh gosh, I don't know what to do," would you respond with criticism or would you respond with, "Oh, help me understand what's going on"? Probably curiosity, kindness, how can I help? So if we can work towards talking to ourselves like our very own best friend, that can really begin to shift because self-compassion really helps dissipate stress and worry. So it's about attempting our best to be kind or noticing when we're not kind and working to be more kind. And then remembering if we're really feeling like we're in a difficult time, often it's like, I feel all alone in this. And I want to let you know you're not all alone. There's other people who are feeling the same way. And even just reminding yourself of that is so helpful, is that I'm not alone. I'm not the only one who feels this way. There's other people that feel like I do too. And the last is mindfulness, which is a part of self-compassion, being present in the moment. Um, yeah. So I think, is there the next slide there? Is there an... Yes. So I've kind of already indicated you're not alone, right? Like, and remembering that, and there's organizations like Diabetes Sisters that you can gain information from, resources from, as well as other resources to help you feel more connected to your community. You know, fear is a part of the process. Fear is a natural human emotion that is protective in nature, right? It's a sign that you care about yourself and your loved ones. That is what it's for. It's like, oh, there might be danger. And it's an invitation for us to move towards what might be causing danger. Because when things are scary, our tendency is like, oh, let me get out of here, right? Um, and if we can calm our nervous system and move towards what is scaring us, that knowledge and that action can help us build confidence, compassion, and strengthens our ability to face difficult things, causing us and helping us to be resilient. And I want to leave you with a little quote by Eleanor Roosevelt. She says, You gain strength, courage, and confidence by every experience in which you really stop to look fear in the face. And quotes are not the end all be all because sometimes things are so scary that we need support and we just need to ask for help so that we can get grounded so that we can face the fear. So sometimes we might need to reach out to our doctor and ask for support or help, or we might need to ask, a friend or a family member, or maybe we even need to ask a mental health professional for support if we're having some challenges in that area. So I'll hand it back over to Dr. Bouhair.
Thank you for that, Jude. That was just so powerful, and really helps because there's so much psychological and mental barriers when it comes to screening. So thank you for all those wonderful points. To get more information about screening, what it is, a recording of this webinar, in addition to other recordings around screening, please visit DiabetesSisters.org. Action truly does start with you. There are multiple resources available to you on the website, including the webinars, in addition to downloadable PDFs, resources for yourself as well as your healthcare team.